Communication. You have clients from a wide range of backgrounds, so communicating effectively with them all takes thought and effort. Be patient and courteous. Speak to your clients the way you would like to be spoken to. Different cultures have different customs when communicating, and it's important to be aware of this so you do not misinterpret what a client is saying. Avoid stereotypes. Not all old ladies like knitting. Older people may have a range of conditions that can affect their communication. They might not be able to see or hear you clearly. They may not understand what you say.
Would you like to have some figs? I saw some on your tree out there.
They may have problems remembering things. Or they may have a physical disability that makes them hard to understand. They may speak slowly or unclearly. Be aware of what communication barriers a client has and adapt your behaviour and communication style to the situation. Communication is not just the words we say. It is also how we say the words, the tone of our voice. Listening is just as important as talking when we communicate. Show the person that you are interested in what they have to say. Let them know by words and body language that you are giving them your full attention. Personal space is important too. Don't get too close. Use respectful language. Don't call clients by nicknames such as Sweetie, Ducky, and so on. Use the name they prefer.
They live in Malden.
Be sensitive to your clients' feelings and acknowledge them. If you need to ask a sensitive question, for example, about incontinence, you can start by saying, "This may be embarrassing," or "I want to talk about something which you may find difficult, so please let me know if you feel uncomfortable." Ask open questions when you are talking with a client. Start with words like how, what, where, when, and who. They encourage your client to tell you about something in their own words, not just give a yes or no answer. Don't interrupt and don't turn the attention back onto yourself, for example, by telling them what you would do. Respect the rights of older people who do not want to discuss their feelings. And always respect a client's confidentiality. Here are some strategies to communicate clearly with someone who has dementia and suffers from memory loss. Reduce background noise. Approach the person from the front to get their attention.
It's Judy.
Communicate at face level and use eye contact. Speak on the side of the good ear if the client has hearing difficulties. Don't cover your lips. Speak in a normal tone. Do not shout. Use simple words and short sentences. Avoid questions such as, "What did you do yesterday?" Make statements that encourage discussion. For example, "I like what you're wearing today." Give a compliment to help create a positive mood. Talk about positive feelings.
We could go and sit outside.
Be patient. Allow time for the person to respond. Use non-verbal communication as well. People may not understand the words, but they may understand your tone of voice and body language. Be calm and avoid being drawn into arguments.
Have something to eat?
Always see the person, not their age or their problem. Be courteous, communicate clearly, and always be aware of the needs of the person you are communicating with.
I've got to pick the kids up.